Hello, everybody. Thank you so much for joining us for our health science program specific session. My name is Sharon. I am really excited about this. I am a graduate from the health science program, so I'm glad to be back to help facilitate this. So I'm pretty excited about that. We have a fantastic lineup for you, and I will let them introduce themselves because they're just that great. So I'll let Rob take it away first.
Thanks, Sharon, and welcome everyone. I'm Rob Travers. I'm a professor in health sciences, and I'm also chair of the department.
Hello, everyone. My name is Dr. Stephanie DeWitt-Orr, and I'm the undergrad advisor for health sciences. I am an associate professor in health sciences and biology.
Hi, I'm Eileen D'Souza. I'm a third-year student in health science, and I'm also the marketing exec on the Health Science Students Association.
Hey everyone, I'm Jordan Miko. I'm in second year health sciences, and I'm the second year student liaison for Health Sciences Students Association.
Awesome. Thank you so much, guys. I will let Rob take it away. Rob and Stephanie take it away with the presentation that they've got.
All right, well, we'd like to thank you very much for coming and listening to our little spiel here about Laurier Health Sciences. We're very excited about the program that we have here at Laurier. We think it's special, and so we want to share with you right now why we think it's so special. We know that we approach health sciences from a unique perspective. We have a very interdisciplinary faculty. The professors who work in our department have a variety of different specializations, and we think this brings a real novel approach to health sciences. Particularly, we look at health sciences from a cell to society approach. We know that human health is influenced from the smallest of cells to the largest of populations and societies and everything in between. And we want our health science students, when they leave our degree, to be able to appreciate, understand, and be able to educate others about that spectrum. We're very conscious that we're training future healthcare professionals. And so we want to give our health science students a background that will give them that balanced approach. We want to give our students an evidence-informed decision-making skill set that they can bring to their health fields in the future. The other thing about the health science program at Laurier is that it gives you an opportunity to not only get the degree in health sciences, but also to obtain a minor. You can get minors in biology, psychology, chemistry. You could do an option, or you could do a co-op. So there's lots of flexibility to the degree.
I want to talk a little bit about the environment that we've created over the years in health sciences at Laurier. We've implemented lots of changes given student feedback over time. And we think that we give students a really positive learning experience for many of the reasons that Dr. DeWitt-Orr spoke about, but also for some of these reasons that you see here. We have small class sizes compared to other health sciences programs in the province. And there's something about a small class size that really allows students to succeed. It allows us as professors to implement learning techniques that are quite innovative, that really engage people in lots of discussion in the classroom, and that gives students a fantastic learning experience. One of the things that's very unique about Laurier is in health sciences, we don't have a graduate program, so we don't have a master's or PhD program. So all of the opportunities that typically in a university that would go to master's or PhD students, like teaching assistantships or research assistantships, actually go to our students, our senior students, particularly in year 3 and year 4. And what that means is by the time they leave us, they're really phenomenal researchers, and they've got experience as a teaching assistant as well. They have other opportunities to work very closely with us through directed studies, which are a credit course where you, under the supervision of a professor, delve very deeply into an area of interest for you. You work directly in a professor's lab as a result of that. You can work with professors on research in their labs as volunteers or paid research assistants. And you have an opportunity to do a 4th-year honors thesis, which is essentially carrying out your own study from start to finish and hopefully publishing it before you leave Laurier. We have a very tight-knit community. We are a very happy and positive and upbeat department. We look at this as everyone is in this together, and one of the things that was said in a recent introductory class was a professor asked, how many of you want to go to medical school? And about 65% of the students indicated yes, they wanted to go to medical school. And what she said back to them was, we're here to help you on that journey. And that's what we're all about in health sciences.
Thanks, Rob. I also wanted to point out in that last slide that that was an image of one of the synthetic cadavers that Laurier has for their anatomy class. We have two of them, Rita and Sarah, and they are the we're the only university in Canada with full-size synthetic cadavers. So students at Laurier can use these cadavers to learn anatomy in a hands-on environment. So to continue, why choose health sciences at Laurier? Because we have superior student supports. So when you come to Laurier, you're not alone. You're not a number. We have, as Dr. Travers mentioned, not a small program. And that means that we get to know you. We know your names. We know how you're doing in your classes. And this is not a creepy thing. This is a really great thing because it means that there's a community around you. You're not alone. And not only do you have that support within the Department of Health Sciences, but there are academic resources on campus. So there are programs called SI sessions, supplementary instructional sessions, that I'm sure our students can talk about later. There's also the Math Assistance Center, which is particularly helpful for first-year math courses, where you can get that support that you need to be successful when you're transitioning from high school to university. We also have healthcare supports, mental health, physical health supports on campus. We have early alert programs, just in case you are having a hard time in a course, so that we can try to catch you and help you before you get into too much difficulty. We also have designed the health sciences program so that you are getting all the prerequisites you need to get into the professional medical programs that you want to get into. First and second year is when you are taking your introductory courses, all of those basic foundational scientific courses that you need to take the further third and fourth year courses that are specializing in specific areas that will take you where you need to go, give you those prerequisites you need to get into dentistry or optometry or pharmacy or medicine. So we have very consciously designed the curriculum for health sciences to give you success in applying for those future medical or future healthcare profession programs. We also have the Health Sciences Student Association, HASA, and we have two members here today, and they're going to be talking to you later about what HASA does and how it can support you as well.
So one of the things we really want to emphasize is that our students are very successful. They go on to professional programs and they go on to graduate programs. And I just want to walk you through some of the areas that they've been really, really successful at achieving their goals in. Before I do so, I want to point out that there's 4 of our students on the left there. This was a story that they were featured in a Laurier communication story. And they're all medical students at the University of Toronto right now, and they've gotten into U of T over the last couple of years. So in terms of professional programs, our students go on to medical school, dental school, pharmacy school, optometry, nursing school, naturopathic medicine, chiropractic college, clinical audiology, physio, occupational therapist, speech pathology, and I would add in chiropractic medicine there as well. I would say as many of our students go on into other graduate programs at the master's level in population or public health. They realize as they go through the program that the healthcare sector is very broad, very expansive, and very complex, and that there are lots of opportunities to engage in future training that can take them into areas, for example, being a health policy analyst or a public health promotion officer, or those kinds of things. So the grad programs, they're very successful at getting into our public health, population medicine, medical sciences, health services research, epidemiology, health policy, and global health. So as Dr. DeWitt-Orr said, we've designed a very unique program that gets people into these kind of 2 very specific areas in their future, either a professional program or a graduate program.
Awesome. Thank you so much for that very detailed presentation. Had a ton of really great information, and it's just like fun even as a graduate from that, going back and just realizing what I had learned and all the cool stuff that I had done. And I'm excited for future students to be able to take advantage of those opportunities for sure. So I have a couple questions for you. So perfect, you've got that slide up right now. So my first one to you is, a lot of students have the question of, what do I need to get in? What kind of classes do I need? So what is the average to get into this program?
That is something that has changed considerably over the 10 years that we've been around as a program. So I'll take you to the bottom bullet of the slide 4. In 2009, our incoming average was 80%, and our incoming average in the fall of 2020 was just over 90% at 90.5. So from high school, you need advanced functions, biology, chemistry, all at a minimum of 60%. And all of your prerequisite courses are calculated in your admission average. About 150 students are accepted each year, sometimes as high as 165, and about 1,350 apply. While it says in Laurier promotional materials that it's a mid-80s average to get into the program, really the competitive average is the low 90s. So if you're an applicant in the low 90s, your chances of getting an early offer of admission are quite high.
Absolutely. Thank you so much. And then just to go on with that, let's just say they've got that 90, they've got those grades, they're in. What does the health sci curriculum look like? What's it look like from year 1 to 4?
Just keep clicking, Rob. I don't know why it's doing this. Oh, great. Okay, so it has an animation attached to it. Keep going, Rob. So let me tell you a little bit about what your degree will look at like if you come to health sciences. Year 1, this is year 1 and 2, like I said before, are giving you those foundational courses that you need to take the specialized courses in years 3 and 4. So year 1, you're going to be taking introductory bio 1 and 2, chemistry 1 and 2, health issues 1 and 2. You're going to be taking calculus. Well, and then a psychology 1 and 2. And then you have an elective, and this is new in our curriculum, that we're allowing an elective in first year. We suggest that you take English because you have to take an English during your degree. So that's what we suggest for year 1. Year 2, you're going to be taking anatomy and physiology. You'll take intro organic chemistry. You'll take research methods, statistics, cell biology, psychology that you get to choose from a group of psychology courses. You'll be taking Canadian healthcare systems, and you'll get 1.0 credits of electives, so 2 courses of electives in year 2. And what I want to just clarify is a lot of these courses that I'm talking about are being hosted by other departments. So health sciences does not teach biology 1 and 2, biology does. But the health science courses, so you'll have a lot of different students in biology in those first year biology courses. But the health science courses, like health issues, are only for health science students. So that's where you're going to meet your health science cohort. That's where you get to meet all of your peers. And we've guaranteed that every year throughout the degree, at least one course per term is just for you as a health science student, so that you get to build that community. Okay, so that's year 1 and 2. Those are your foundational years. Now year 3, you're going to be taking epidemiology, social determinants of health, introductory immunology. That's what I teach. So I'll be looking forward to seeing you then. Introduction to Indigenous health and well-being, introduction to human nutrition, and 2.5 credits of electives. And we find in year 3, a lot of students are using these electives to take some of the prerequisite courses that they need for their future professional programs that they're applying to. So a lot of students are taking physics or additional chemistries to try to get what they need for where they want to go next. And year 4, there's a course, HE400. It's the multidisciplinary seminar on critical health issues. And this is our capstone course. This is where we try to bring together everything from the beginning to now the end of your degree, and really tie together that cell to society approach that we've been trying to instill in our students throughout the 4 years. In addition to HE 400, you're required to take 2.0 credits of senior health science courses, but you get to pick from a whole slew of them. And this is where I find is really exciting, where you can pick really neat courses that pique your interest. So pathophysiology, virology, parasitology, exercises medicine, advanced nutrition and chronic disease, public health, global health, health and aging, health and human rights. These are all courses that you can choose to take in specialized areas. Now, we also offer directed studies, which is a 0.5 credit, 1-term course where you can do some research with a professor. Or we have an honors thesis course, which is a 1.0 credit, so a full year, where you get to work, you go to class, and you also get to work with a professor on a research project, and you write a thesis at the end. So there is integrated into the curriculum research opportunities.
Awesome, thank you. And these are really cool because they're very unique classes, especially when you get up into your 4th year, that you're able to just pick from all these really neat classes. I particularly love parasitology and did a directed studies with them as well. So it's really cool that students, yes, you're getting that foundation, but can also take these niche courses within this program as well, especially in 4th year. So my next question, so lots of students are coming in and wondering about their MCATs, wondering how this path can lead into medical school and if this prepares you. So would you mind speaking a little bit on how does the health science program prepare you to write your MCAT or to get into medical school?
All right, well, we've designed this program to give you all of the courses that you need to get into medical school. We also have a pre-med society, so student-led program that supports health science students who are looking at applying to medical school. So not only is this something we know a lot of our students, the priority for them to get ready for the MCAT and apply for medical schools, but we have peer support groups as well. I don't know if Aileen or Jordan, do you have any extra input on that?
Yeah, with Pre-Med Society, they host numerous events that help tailor your undergraduate journey as you approach medical school. So they have many events from MCAT to interview tips to Casper. So specifically with Pre-Med Society, they have a bunch of events and initiatives that are being taken to help you further your journey throughout your undergrad.
I would add one thing too, that we've designed the program in a way, and Dr. DeWitt said this again, and I want to reiterate it. We've designed the program in a way so that after year 3, some very exceptional students who have top grades go on to medical school or they go on to dental school. So they graduate with a general BSc, but last year, I think three students left after year 3 because of their very high averages and their excellent MCAT or DAT scores, and were able to successfully enter medical school or dental school as well. So that's something quite unique about our degree as well.
Thank you. And I mean, I did write my MCATs as well. And so I found that this program in particular had helped me quite a bit with finding all the foundation that I needed to know. For sure. And I know that y'all were talking about, different jobs. People are going into dentistry, people are going into med. Can you elaborate just a little more on the different jobs that students can get after going into this program?
So students use this program as a stepping stone degree to go on to other areas like medicine or dental school, chiropractic college, physiotherapy, and then a whole host of graduate programs as well in public health or epidemiology. So a graduate degree or a master's degree in epidemiology would be very beneficial right now in terms of the COVID pandemic. I mean, it's epidemiologists who are following the progression of the illness, the communities that it affects the most, identifying trends, statistical trends. We're seeing particular communities that are either low income or racialized that are disproportionately affected by COVID. And that all of those discoveries are primarily the work of epidemiologists, for example. We have other graduates with public health or global health master's degrees who go on to do public health policy work, research in hospitals, research in non-governmental organizations. They're in a whole host of different places. And then we have lots of people that are working with professional degrees, either as physicians, dentists, chiropractors, physiotherapists, etc.
Awesome. Thank you so much. And then I know, Rob, that you had touched on this earlier, that since we are a primarily undergraduate institution, that we rely on those students to help in research as well. What are some research opportunities that are available to students?
Well, I encourage students to reach out to professors in their very first year at Laurier. Just introduce themselves by email and say, I find your research really interesting. Would you have a space for me in your lab, either at this point or in the future? Right? It's a really, really good way to reach out and start to think about, how can I develop some research skills and a relationship with a professor early on, right? Because you want to think about the time you get to the end of your degree. You need that solid relationship with professors because you're going to need reference letters to go on to either a professional program like medicine or a graduate program like, let's say, public health. Our undergraduate students have been very, very successful in doing research. When I look at my own research publications, I would say that the last 15 or 20 papers that I've published have students as first authors, and most of those have been either directed study students or honors thesis students as well. And we thoroughly believe that the more research you do early on in your first degree like health sciences, the better a healthcare professional you're going to be, and that you're learning to use evidence to make decisions about health issues. Stephanie, I don't know if you want to add anything there. I know your lab is very successful at engaging undergraduate students as well.
Yeah, I think that we have opportunities to do research with professors on a volunteer basis. So you could come and work in a lab volunteering. You could do research as a directed study student. We actually have directed studies courses that are available to second and third year students as well. So you could start that with professors and get credit for it in second year or third year. And then we also have the fourth year directed studies plus the thesis class. And then we have summer grad assistantships that students can apply for so that you can get paid to work with university professors over the summer. And of course, a lot of the professional medical programs that students are looking for the future, not only do they want reference letters for that, which professors can provide, and those reference letters are so much better if we know you and know what you're capable of, but also you could get publications, as Dr. Travers mentioned. You become more mature as a scientist with more experience that you have in a laboratory setting. So the research opportunities that can be offered at Laurier are really exceptional and will give you an edge in your application package.
Absolutely. Yeah, I think those reference letters as well, super important for sure, and a great way to get them as well. So I have another question for you. So what essentially is the difference between health science program at Laurier versus maybe the biology or the chemistry or the general science program?
So the advantage of a health sciences program is that it's specifically focused on human health. All of our courses are building towards you as a student better understanding human health from a multifaceted cell to society approach. If you take a biology program, a biology program, it will focus you in biology, and that's lovely and that's great, but it's not going to give you a human health perspective. It's going to give you a perspective on life, right? Biology is the study of life. So, and then same thing with chemistry or general science, it's not going to give you that specialization in human health. The other thing is, as we've mentioned a number of times now, our program is designed to give you the prerequisites you need for future medical professional programs. And those other kinds of programs, while they're wonderful programs, they weren't designed with that in mind. So when you're considering health sciences versus other programs, just keep in mind that they weren't designed to give you what you need for your next step.
Awesome. Thank you so much. And then my next question would be, these are all fantastic questions. What percentage of students who graduate from the health sci program are pursuing further education, like grad programs or med school? And even seeing as Laurier doesn't, like, we don't have a medical school, we're not affiliated with a medical school. For those that want to pursue that, what are their chances to get in going to be impacted by this?
I would say that about 85% of our students are pursuing future education and are doing very, very well. They get into extremely competitive programs. The fact that Laurier doesn't have a medical school does not seem to hurt our students in terms of their chances of moving on into medical programs. And I would return to that those points that we made before, that because we don't have a graduate program and we offer all kinds of opportunities to undergraduate students, like teaching assistantships or research assistantships, that we build the capacity of our students in a way that's quite sophisticated, I would say, and we turn out very, very strong researchers. So I think when professional and graduate programs are looking at our applicants and they see something like a published paper with let's say Eileen as a first author, they know right away Eileen can do research, and that's a student that we want.
Absolutely. Thank you so much for that, for both of you. Really provides lots of clarification for sure. Now, I kind of I'm going to switch gears a little bit and go to the students to just get a little bit of their perspective. So the first question I have for you guys actually living the program right now, what can you expect as a first year student? If both of you want to just take a shot at that, that'd be awesome.
Yeah, for sure. So first year is definitely a change from the high school environment. And we're going to speak about this later. It is like a bigger class size because we lay the foundation. So there's the biology, the chemistry, the calculus. So they are bigger classes, but I feel that the program does a really good job of making sure everyone has the same foundation. So I know a lot of people that I've spoken to before were scared going into like a health science program and not feeling like they know enough. But all the first year courses make sure that everyone starts at the same level and make sure that everyone has the same background knowledge before advancing to further years. And this also speaks on the class sizes. So the class sizes are bigger, but we always have the health science class to make sure that we all know each other. And that you do know the people in your program, because it can get a little overwhelming.
Yeah, I couldn't agree more with Eileen. Regarding the class sizes, I know that biochem, calc, and psychology, they're fairly heavy. They're on the larger side of the numbers. But what health science that Laurier does really well is the fact that there's HE or health sciences courses every term, which you get to be only with your health sciences cohort. So you really get to know everyone in your program. You get to meet new people on the first day and you continue making those long-lasting friendships. So I really like that about Laurier's Health Sciences. It really builds a tight-knit community, a strong peer community.
Absolutely. And you guys were mentioning the classroom sizes. You said first year was a little bit bigger, and kind of what was kind of mentioned earlier was because, let's just say, a biology course is taken by not just biology students, it's biochem students, health science students. So what is the actual classes going to be like in terms of size, and does that change from first through fourth year?
Yeah, so the first year, as I said, it's significantly bigger, but as the years progress, the classes get smaller and smaller as you specify in a specific career field that you kind of want to go into. So first year, there was about like 200 people in my class. But now that I'm in Rob's class, we only have Dr. Travers's class. We have about 50 students, and I can say that I know all those 50 students, and they're all health science students, and I can know them all by name. So Vern, do you want to say anything about that?
Yeah, with I guess my first experience with psychology, for an example, my class size, there was around 300, 400 students, and that was just my class alone. There was other psychology courses. But as Eileen said, as you progress throughout the years, it kind of windows down. So especially with certain further health sciences courses, the fact that there's so many options and everyone's so different. Everyone's going to prefer one course over another. One might take immunology instead of biology, for an example. So like it goes from like hundreds to like 50 or less. You really get to know the professor. You really get to know the people in that class. So
Yeah, absolutely. And that's what I particularly loved about that too, is because you do get to know everybody in your program. You recognize everybody. You've got a name to the face, and I absolutely love that too. So I got a question for you, just in terms of just kind of life in general at Laurier. What is the residence like, and what was kind of your experience with that as a health science student?
My first experience was amazing. I got to meet my Dawn, which are upper year students who help out research transition from high school to university. I had some fantastic roommates who I still talk to. I got to meet people on my floor, other people throughout the building. So that was my first experience. I had a grand time. What to expect with residence is just an awesome and safe space for you to thrive, academics, socially, you name it. Everyone's here to support everyone, whether it be your Dawn, people on your floor, throughout the residence. Everyone wants to see you succeed. And there's many amazing opportunities. So for an example, there's Residence House Council. So each residence has their own specific council, and then within that council, there's specific roles, and they help with programming throughout that residence. So they plan events for everyone in that residence. So that's just another way for you to get involved. There's various types. There's dorms, there's apartments. So whatever you prefer, you have the option to choose from. As well as there's a thing called residence learning communities. So in our situation, there's a science residence learning community where you can be around other like-minded individuals in the faculty of science. So it's not just health science students, they could potentially be biology, chemistry, data science, computer science. So that's just another way to enhance your residence experience and university experience by being a part of the residence learning community for science.
Absolutely. And that's just amazing because yes, you have your supports in the classroom, outside of the class, but then also in residence, like you said, with those learning communities where you can be on a floor or in a building with those that are in the same program as you, building more of those relationships, which is pretty awesome. And then lastly, just to touch on a little bit more of HASA, what you guys have been doing, what kind of different additional helps are there for students who are struggling in class? What does HASA do for students? And what have you actually taken advantage of as well?
So coming in for first years, we offer a mentorship program in which we assign a first year to an upper year student, and we give them their emails, and they're able to always reach out to that mentor if they do need any assistance. So that's like the first thing we do offer health science students. In addition to that, for classes, I said before, there's SI sessions, and definitely take advantage of those because one of the students who've taken the class before and done exceptionally well teach each week's lessons back to the students. So it's a good review session, and they're there to help you. So I've definitely taken advantage of those too, personally.
Yeah, and to add on, I really want to stress and emphasize this, that everyone in the health sciences community wants to see you succeed. Like it's not only teaching assistants, but it's, upper year health science students want to see you do well. It's your professors that want to see you do well. It's also people in your year and your cohort that want to see you succeed and be the best as possible. I know I experienced that. I know I turn to my friends in my year, whether I need help or just advice with anything. So everyone just wants to see everyone be the best.
Yeah, we always tell first years to always, first year, second years, any year, to just reach out to us because we are more, we'd love to help them and answer any questions that they would like to ask.
Absolutely. And I think that's so great that you have that as well. I feel like there's definitely a little bit of an intimidation factor, or I don't know what to do or where to go. So the fact that you even provide that for those first year students to be like, no, like, it's okay. Like, we're here to help you. We're on your team. It really does show the community and how, like both of you said, Eileen and Jordan, that it's a really building each other up. So we're not tearing each other down, and we really want to support our students in any way that we can from multiple different facets. So with that, that was my last question that I had for you guys. This was so much fun. I just wanted to thank you all for answering all these fantastic questions. You've brought back some memories. I'm like reliving my health sci days, and I've absolutely loved it. For all the students tuning in, just wanted to let y'all know about our virtual Laurier experience. If you haven't already found it online, there you'll be able to see lots more information about campus, virtual tours, and then there's where you can book an AMA or an Ask Me Anything with one of our campus ambassadors. So if you want to carry on this conversation forward, you want to hear more about the health science program, you've got any questions after this, if you go right online, you can book an appointment with some of our program-specific health science campus ambassadors, and they are there to help you out. So again, thank you so much, everybody, for hanging out and for all this awesome content.